Hi folks, it's Jill from the IC Network office, and I'm here today to give you another self-help strategy so that you can live more effectively with IC. I want to talk a little bit about pelvic floor dysfunction and physical therapy. Now, we know that a significant number of IC patients struggle with pelvic floor tension. Why? Well, we're not really sure, but what we do know is that sometimes when you're in pain, your body tries to protect you. And the way that it does that is by tightening muscles. So in some cases, pelvic floor dysfunction can begin because you're having a bladder issue. And in other cases, pelvic floor dysfunction can begin because of some sort of traumatic injury or accident that might have occurred. PFD can occur after childbirth, and it sometimes happens to bike riders who put an abnormal amount of pressure on their pelvic floor when they're sitting on a bicycle. So getting diagnosed for pelvic floor dysfunction is very easy as long as you have a medical provider familiar with it. Sometimes a urologist can do it, or an IC research center. Sometimes an OBGYN might do it, and in many cases a physical therapist who's been trained in pelvic floor work can do it. And I will say, from a diagnostic standpoint, it's one of the easiest tests that you can have. It's absolutely nothing to fear. Normally what they do is they look at your musculature from the outside. They might measure your legs to see if one leg might be longer than the other. They might look for tension patterns in your legs or in your hips. And then they may also do a very gentle, brief internal exam to see if they can find any tight muscles in your pelvic floor. For women, this is done vaginally, and again, it's nothing to fear. It's very easy to do. And for men, it's done rectally. So once you've had a pelvic floor assessment and you've been diagnosed with pelvic floor dysfunction, you're often referred to a physical therapist. Now, fair warning here, Kegel exercises are not something you normally do when you have pelvic floor dysfunction, because when you have PFD, your muscles are super tight. And what's a Kegel supposed to do but to tighten muscles? Does it make any sense to tighten a muscle that's already too tight? No. Which is why people with pelvic floor, when they do a Kegel, it often hurts. Instead, our goal is to relax that muscle. The focus is on lengthening muscles, calming muscles down, and relaxing them. And so don't just assume that you can do Kegels and get better and not go to the physical therapist. You really do need to spend a little bit of time with a physical therapist to learn the proper exercises and routines. And of course, if you have trigger points, they might want to work with those directly. But even physical therapy once a week isn't really enough. You have to have a good at-home program, because there may be things that you're doing at home that could be reinforcing that muscle tension. I have a couple of resources for you that you might find very helpful. This is a wonderful book written by physical therapist Amy Stein from the New York area. This came out in the fall 2008 and has very quickly become our pelvic floor and physical therapy Bible. What's great about this book is it explains it in depth, but it also gives you a lot of exercises that you can do at home that you might find very, very helpful. Strongly recommend this book. Then the other thing that I have is equally important. In fact, it might even be a little bit more important. It's a CD, and I hope it's not too bright in this light. It's a CD produced by the WISH program at Beaumont Hospital in Royal Oak, Michigan. And Royal Oak, Michigan and Beaumont Hospital is one of the most dynamic IC research centers out there. The chief of the department is Dr. Ken Peters, who is well known for exploring very diverse aspects of IC. And one of the things that they've done in the last couple of years is really focused on physical therapy. And they've produced a 2-CD series that walk you through how to relax your pelvic floor. This one is called Guided Imagery to Enhance Healing for Women with Pelvic Pain, Interstitial Cystitis, or Vulvodynia. then there's another one that has a very similar title. We recommend that you listen to these once a day minimum, and maybe even twice a day if you're in a flare or your pelvic floor is spasming. So the good news here is that pelvic floor dysfunction is very treatable. But you have to have not only a good physical therapist who's very familiar with how we treat it today, but it's also your responsibility to have a good home care plan so that you can recognize pelvic floor tension when it's beginning and then take action to nip it in the bud and help your symptoms go away. I really hope that these help you.